I'm Matt Willis, Public Health Officer from Marin County with a COVID-19 update for September 29th. Yesterday, Marin County Public Health announced that starting November 1st and through the winter virus season, people in hospitals and skilled nursing facilities will be required to use masks in certain areas. We know mask use has been politicized and is potentially divisive, so I'm going to explain why we took this step. Here's the essence of the order. Starting November 1st, everyone, staff, patients, and visitors in a hospital or skilled nursing facility will need to wear a mask in patient care areas, regardless of vaccination status. Children age 5 and under are exempt, as is anyone with a medical condition that prevents them from using a mask. It doesn't apply to facility cafeterias, break rooms, or administrative offices where patient care doesn't happen. And skilled nursing facility residents won't need to mask up when they're in their rooms and not out in common areas. The order is intended to prevent infections between staff, patients, and visitors in these especially vulnerable settings. For most of us in the general public, wearing a mask to prevent infection really started in the pandemic. It was new. But mask use in healthcare settings has been routine for infection control for decades. Doctors and nurses have always used masks when they care for patients with coughing or sneezing because they're a proven barrier to infection. So the debates about whether we should be tossing our masks have never really applied to healthcare. The question this order answers is really where and when should masks be used in our most sensitive clinical settings. Here's the answer to when. Every year, RSV and flu spike in fall and winter. It's just part of the season, as reliable as leaves turning or days getting shorter. Every year, on average, 35,000 Americans die from influenza infection, and almost all of those occur between November and March. Until recently, public health has relied on case counts and lab tests to see when these viruses start to flow in our community each fall. Last year in Marin, we had a new tool, measuring the virus itself in our wastewater. And this showed a remarkably clear rise and drop from November through March in both flu and RSV. We've also seen COVID-19 surge every fall, although it stays around all year and we see spikes in other seasons too. So while COVID isn't purely seasonal in the way flu and RSV are, it tends to be more active in the winter. So we can predict the interval where flu, RSV, and COVID-19 will be circulating at the same time. And that information guides the timing of this order, from November through March. If you're interested in watching our community virus levels for COVID, flu, and RSV to see when we start to see that seasonal surge, you can look where I look, at our Marin County Wastewater Surveillance Dashboard. Regarding where this applies, this is not a mask mandate for the public. If you don't set foot in a hospital or skilled nursing facility, it won't apply to you. Hospitals are uniquely vulnerable settings for infection for a few reasons. Number one, people go there when they're sick, so you have more likelihood of exposure. Number two, the patients are often older and medically fragile and are more likely to have severe illness if infected. And number three, there's a lot of coming and going and mixing of people with close interactions indoors. And finally, masking also protects our critical frontline healthcare workers. In past winter virus surges, when we've been close to overflow in our hospitals, it's as much due to staffing shortages as about hospital beds. This happened last year when flu and RSV were added to COVID-19 in what some called the triple-demic. We need to keep our healthcare workforce healthy and our hospitals strong so they can be fully responsive to all conditions like heart attacks or injuries. Regarding skilled nursing facilities, every year we see flu outbreaks in Marin facilities, and these now double up with COVID-19 outbreaks. Respiratory viruses spread easily in these settings, and these outbreaks often send people to the hospital and cause preventable deaths. In fact, the majority of COVID-19 deaths since the start of the pandemic in Marin County have been among long-term care facility residents. Measures to prevent infections in these settings save lives, along with vaccination and getting treated for COVID-19 infection early. This requirement is narrow in focus to get us through the winter virus season in two settings where preventing infection is hardest and where the consequences of infection are greatest. It's important we take every reasonable step to make our hospitals and skilled nursing facilities as safe as possible, and masks are a simple and proven measure we can all take. framing this as a requirement and not just a recommendation will help our facilities enforce practices they know will protect staff and patients best. Stepping back, for all of us, the protection of the vaccines, getting treated if you're infected with COVID, and making the choice to wear a mask in indoor public settings if you're at high risk will set us all up for a healthier winter together. Thank you for doing your part.